welcome everybody to today's special episode of Physiology Made Easy. And today I'm actually joined by Sean Seale. Now, Sean, thank you and welcome to today's show.
Yeah, it's a pleasure to be here, man.
Thank you very much. And it's slightly different to what I would normally do on my YouTube channel, but I think the viewers are going to find the content today very interesting. Now, Sean actually contacted me earlier this year, and he'd watched some of my videos, and he had some questions about some physiology questions about the videos, and we thought that we had this conversation by email, and we thought that the questions that he's asked, which are really good questions, they would actually be beneficial to my viewers that watch, content on, physiology in terms of like the revision, but also to Sean's clients. Now, Sean is a strength and conditioning coach. He's a personal trainer, performance consultant, and he's based in Nyon in Switzerland, which sounds like a really beautiful part of the world to me.
It's quite nice. It's quite nice. I won't deny that.
Okay, so you probably got the mountains and the sea as well, I presume.
Oh, we got a lake, but it's close enough.
Okay, that's fine. Okay, now Sean, has got a wealth of experience. In the description of this video, you will see all of Sean's details. So I'm going to put up links to his YouTube, WhatsApp, Twitter, and all of the other social media channels as well. So you can actually see what Sean does. But in any case, this Sean is dedicated to improving, the performance of athletes and teams around the world, and he works closely with his clients in that respect. Does physiological testing as well. So really, he's got some very good knowledge, and I was very impressed by the questions that Sean put to me, which is why this kind of podcast today came about. Things that Sean likes to do in his time off is actually listening to podcasts, so you'll probably end up listening to this one back at some point.
I probably will.
Yeah, I do the same, to be honest. It's how you kind of learn and find interesting things. Swimming in the lake, so that's great, and also doing gardening as well. So quite an active and interesting set of hobbies as well. So Sean, I'm going to hand over to you now to ask some of those questions, and I will try my best to answer them as concisely but informatively as possible.
Yeah. First of all, I really want to say thank you for having me on. It's a pleasure to be able to talk to you directly. Like you said, I had some questions after I watched many of your videos. They're really, really great videos, and I learned a lot. I don't come from an academic background. I learned everything. YouTube University is kind of where I learned most of what I know. And so channels like yours, I feel, are extremely important and valuable in that regard. So thanks for that, first and foremost. So the questions I had today are kind of centered around blood flow and around the heart, especially. The first one that I had was about left ventricular eccentric hypertrophy, so essentially enlargement of the left ventricle that we usually associate with some low intensity training. But I've heard kind of opposing positions on this. Some people say you can actually affect it through training. Some people say it's really hard to affect it through training. So I wanted to get your perspective on the matter, since you're in this kind of data and information all day long. So from your standpoint, can left ventricular eccentric hypertrophy be affected through training? And if so, what type of training would that be?
Okay, so it's a really good question. Now, firstly, left ventricular eccentric hypertrophy is often known as athlete's heart. So some people might have come across the fact that endurance trained athletes have very large left ventricles, which allows them to pump more blood around the body. And this is why they get this efficient blood flow and have very high levels of fitness. So, and also you mentioned the term eccentric hypertrophy. So that's one of the types of hypertrophy that happens. The other is called concentric hypertrophy. So before I answer your question, I just wanted to define to the viewers and to the listeners what those two types of hypertrophy are. Now, eccentric hypertrophy is what happens when you have lots of blood coming back into the chambers of the heart. So I've actually got a little heart model here. Now, imagine when you're doing exercise, endurance training, you're getting more venous returns and more blood returning back into the atria and to the ventricles. Now, what that does is it stretches the walls of those chambers like an elastic band stretches if we pull it, and with time that makes the muscle, the heart muscle, more compliant. and it allows more, it's what we call volume overload. So we have more blood volume in the chambers. So when you do endurance training, dynamic exercises like swimming, running, cycling, those groups, those exercises that use large muscle groups, then what you get is lots more blood coming into to the atria and to the ventricles. They fill up, they stretch more, and because they hold more blood, when they contract, more blood is then pumped around the body. So the whole process becomes very efficient. And that's what we call eccentric hypertrophy, and it's the dynamic exercises that lets that happen. Now, the other form of hypertrophy is called concentric hypertrophy. Now, in that, what you get is you don't get an increase in the blood volume. You don't get the chambers getting bigger. The chambers become thicker, and the area inside the chambers actually becomes smaller in diameter. The chamber diameter becomes smaller, and concentric hypertrophy means that you get more mass in the left ventricle. So your left ventricle will grow in size, but it usually happens because the pressure that the heart has to overcome to pump blood into the circulatory system is really high. So sports that have isometric type movements, so static sports, and examples of sports like that might include golf, where you're really gripping the club quite hard, throwing sports, wrestling, those type of sports where the muscle is contracting, but it's not necessarily having that movement of blood as you would in a dynamic sport. That creates pressure in the circulatory system, and the heart adapts over time by increasing the mass, the cardiomyocytes, which are involved in the contraction. So it adapts by increasing the cardiomyocytes. So you get this very thick left ventricle. What I wanted to do is I've got a picture just here just to illustrate. So I'm going to share my screen. Bear with me a second. Even though I do use Teams and stuff like this for teaching, I'm still sometimes I'm trying to look at where I need to share the screen. So here it is. So if I go share content, I'm going to share this window. So can you see that window? Or hang on, let's have a.
Yeah, I see your presentation, or is it a document that you have open here? I don't hear you anymore, though. You might have muted yourself.
Okay, so perfect. And so you can see on the screen, you've got two kind of figures of the heart. Mm-hmm. You can see that. Okay, that's fine. So what you can see here then is you can see what I was talking about with the concentric overload. So this is where we get pressure overload on the heart, and you can see that the kind of the chambers that are the area where the blood is much smaller, and the mass, the cardiomyocytes, is much greater. So you're getting this very thick, thickening growth of the heart muscle. But whereas in eccentric hypertrophy, as I was saying before, we get more blood going into the heart, more compliant walls. You don't get as much thickening, but the heart is probably still just as strong as in concentric hypertrophy, but you also have more space for blood to go into the ventricles, and obviously you then get more blood going out to the heart. So this is the main thing with that. And I wanted to this is another table here, if I'll zoom into this actually, so it's a bit clearer. So we can see some of the sports that are involved in some examples of sports that have dynamic components to them and static components. And as I was talking about before, the sports that have very high static components are throwing events, weightlifting, gymnastics, martial arts as well. And obviously their dynamic component is quite low. And then again, if we look at the opposite end, and if we want to look at sports that have a high dynamic component, we come down and we see these very endurance-based sports, especially down here as well, triathlon, cycling, rowing. These are sports that are using large muscle mass, and lots of blood is being pumped to the body, but also being returned back to the heart as well. And one of the mechanisms that we get an increase of venous return is venoconstriction. We're going to talk about the skeletal muscle pump later on as well, but we're getting more blood back to the heart, so you get this volume overload, and then you get hypertrophy of the left ventricle. So I'll just quickly stop sharing the screen. So that's kind of like an overview of what happens with eccentric left ventricular hypertrophy.
Would got a little follow up on that. Would you say that there's a a link, or maybe even the tight link between that left ventricular eccentric hypertrophy and lowered resting heart rate in endurance athletes that we see usually?
Definitely, yes. So one of the so the lowered resting heart rate is called bradycardia, and you'll typically find endurance athletes have heart rates as low as 35, 30 beats per minute. And when you consider that in the general population, your heart rate is going to be somewhere between 70 to 80 beats per minute. So it's quite significantly lower. And this is simply because every time the left ventricle contracts, because it's able to contract with more force and because it fills up, it's got more room to fill up. Every time it contracts, the more blood goes to the rest of the body. Mm-hmm. So the stroke volume, which is the amount of blood pumped with each beat of the heart, is greater. So when the heart contracts, you get much more blood injected to the circulation. Now, if you take a sedentary person that doesn't exercise at all, and their average heart rate is like 80, then what happens is their stroke volume is less, because they don't have the strength in their cardiomyocytes to make those forceful contractions, and so the heart rate compensates. So the heart beats more to still get the same amount of blood to the working tissues. But in an athlete, that one beat, an injection of blood, is enough to provide the oxygen to the tissue, so it doesn't need to beat as many times. And the good thing with the lower heart rate is then you have less energy demands. The heart doesn't need to have as much energy requirements because it's not beating as often. So that's the benefit of that as well. So yeah, it's one of the adaptations that with endurance training is the efficiency by which the heart beats. And I mean, I'm not going to go off topic because otherwise we could go really, but obviously there is the autonomic nervous system controls our heart rate as well, and that's another way in which we can have alterations in the resting heart rate with training as well. But that's a slightly different mechanism. In terms of exercise training and left ventricular hypertrophy, athletes do tend to get that lower heart rate bradycardia because of efficient contraction, better stroke volume with each beat of the heart.
Yeah, and so if building onto that little presentation that you put together, thanks for that, by the way. What type of training are we looking at? We kind of teased at it with the endurance side of things, but what type of training, what's the role of intensity? And then also how long does it take for those changes to happen would be my question.
Okay, so in terms of the type of training, so you really want to be doing, you need to be doing endurance training. So a high intensity training, you need to be, obviously if you're a novice, then you need to build up gradually. But if we were talking about, an athlete, somebody that's at, quite a competitive level, they need to be training, most days of the week. So in terms of the frequency, they need to be training most days of the week. They need to be at quite a high intensity as well. So we're talking about very close to the ventilatory or anaerobic threshold. So this is the point just before they will accumulate fatigue, lactate and hydrogen and have to stop. So it's that point where they're almost at their maximum endurance capacity. So they've got to do not every session, but some sessions in the week need to be close to that threshold, and you can achieve that through interval training as well. And so you have short bouts of very intense exercise with some rest periods in between, or you can do continuous long bouts that are not necessarily at the anaerobic threshold, but some notches down. So in terms of the type of exercises, any type, I think things like running, cycling, swimming, they're brilliant, and cyclists generally tend to have quite enlarged chambers of their heart. So if you take a 20-year-old cyclist, an elite cyclist, and compare them to a normal, non-elite or non-athletic cyclist, the chamber size of the cyclist is going to be significantly larger if you do an echocardiogram. So that kind of high intensity training is very important. You want to make sure that you're doing at least 30 minutes per day, but the session should ideally be longer than that. If you're a trained athlete, you're going to know much more than this working with your clients as well. So it's a mixture of exercises, mixture of training approaches, interval training, continuous training, some hill work as well, anything which taxes the cardiovascular system. And then the second question that you asked was, how long do the adaptations take? Now, this is an interesting question. When you look in the literature, I don't think that the answer is clear. There's no single study or a group of studies that say actually it takes this much time. But when we think about how long it generally, okay, so the way that I would answer this is, elite athletes generally tend to have left ventricular hypertrophy and they large chambers. Now, to be an elite athlete, you've got to do many, many years of training. So my thinking on this is it takes quite a long time, and we're talking years, to get those adaptations to take place. Now, you might be a very good club level, runner or cycler, and you will get some of these improvements taking place. But to get to the extreme end of left ventricular hypertrophy, you probably need to be doing these training programs for quite a few years to be able to get those adaptations taking place. And the other thing that I wanted to mention was these are structural adaptations, and structural adaptations always take longer time to happen. So they don't happen quickly. So if it was like a functional change, those changes happen very quickly in the body. They can even happen after an acute training session. But structural changes take a much longer period of time. Due to the kind of cellular processes that they've got to go through, and the kind of production of new cells, passing on of genetic information, and getting all of the other growth factors and stuff increased, and then they initiate their effects as well. So that takes quite a lot of time. So that's another thing that I would say, that these changes wouldn't happen overnight. It would be a very long process.
Yeah, that's probably why you see cyclists. If you look at the programs of elite cyclists, you'll see them spending, I don't know, 15, even more hours a week on their bike at actually fairly low intensities. You talked about the anaerobic threshold. So if we can loosely equate that with VT2, second ventilatory threshold, or critical power, depending on what model we're looking at, they'll actually spend a lot of time below VT1. So what we call the lactate threshold as well, first lactate threshold, depending on what vocabulary we use. And I guess it's, like you said, it takes a lot of time. Do you know, and as you said, and that's the problem I fell onto as well, is that there's no clear answers in the literature at this point. Do you know if there's an age-related factor as well? Is it better to start early? Do you have an advantage if you do this type of work as maybe a teenager, or even, I mean, you don't want to be doing 15 hours of cycling as a child. That doesn't sound very fun. You should be playing outside and whatnot. But do you know if there's an age, if age has an impact on those adaptations?
I think it is. I think when you're young, you're more likely to have those adaptations taking place. But I think the remarkable thing about the heart is it adapts even if you're older age. So I think probably the extent of the changes would be less in a very older person. So we're talking about somebody in their 50s or 60s, but somebody in their 20s, maybe even in their 30s, I can't see why there would be, physiologically, I can't see a reason why they wouldn't have these changes. I think, starting during the teenage years, as many elite athletes do, they start training, once they kind of reach adolescence, they start serious training. Some before that, but I think, age is important. The other thing that I wanted to mention related to that is some ethnicities generally tend to have thicker left ventricles and more left ventricular mass and strength. So people of Black Afro-Caribbean ethnicities tend to have stronger left ventricles, or they pump with much more force, greater ejection fraction, compared to Caucasians and other ethnicities as well. So there is that effect as well. And it's possible, I was trying to look in the literature about the effect of gender. Now there's probably going to be a male and female difference, and it's probably likely to be males will have possibly have thicker left ventricles than females, but I don't know for sure. I'd have to look in the literature to know for sure. And I think with training, any female will have left ventricular hypertrophy, greater left ventricular hypertrophy than a male who doesn't train regularly or is not at an elite level. And probably when they get to an elite level, if you've got a male and female athlete, they're probably comparable, I would imagine. But without looking into the literature, it's I don't know for sure, but I do know people of Afro-Caribbean descent have greater thickness in their ventricles.
Yeah, well, that's very interesting. I guess the practical takeaway is there's no excuse to not do your endurance training and get your
Yes.
heart big and
Yeah.
efficient, and it's going to
Yeah.
help with both performance and health. So you just got to
That's
go
right.
and do it.
Yeah. Yeah. Yeah.
All right, all right. So as a closing question, I wanted to talk about the muscle and the respiratory pump, because we think
Yeah.
about, when we say pump in the body, we always think about the heart, and yes, it is a pump. It is one of the pumps, but there's also, and I believe you did a really good presentation on the muscle pump. And so, what is the effect of the muscle pump and the respiratory pump on blood flowing back to the heart? And what is the effect of intensity on those mechanisms?
Okay, so what I've got to kind of help you with this help me answering this question is this little model here, and I'm just going to bring my camera a little bit down. In fact, what I'll do is I'll turn it around so that we can see those calf muscles. Now, that always happens. Arm dropped off, but thankfully we don't need the arm. Now, what we can see here. So, Sean, can you see that? Okay.
Yeah. I see.
Okay.
I see
Now,
the calves.
so that we've got the calf muscles here. Now, generally speaking, the skeletal muscle pump relies on the calf muscles and the thigh muscles. So about 90% of the blood that returns back to the heart is through the contraction of these two muscles. Now, the calf muscle generally contributes to about 65% of that. Okay, so 65% of the blood returning back to your heart via the veins is through the contraction of this calf muscle here. And when that calf muscle contracts, so if we imagine that we're going to stand on our tiptoes, then when that calf muscle contracts, it generates a force on the vein, which increases the venous pressure to about 250 millimeters of mercury. Okay, so we have 250 millimeters of mercury of pressure in the vein that is interspersed between that calf muscle. And what that then does is it increases the ejection fraction. So this is the amount of blood kind of flowing out from that vein against gravity to get back to the heart. It increases the ejection fraction to about 65%. So we're having quite a lot of blood returning back to the heart. So the skeletal muscle pump, in particular the calf muscle pump, is extremely important in getting blood back to the heart against gravity. And we find that people that have professions where they're standing all day, so I always think of hairdressers, they might have a whole shift where they're just standing cutting people's hair. They're not moving very much, and so you tend to get pooling of the blood in the lower extremities. Now we do have valves in the vein that prevent backflow of blood. So when the calf muscle does contract and the thigh muscle as well, it propels the blood upwards, and then we have veins that close and they prevent the backflow of blood, and that keeps it always moving in that upwards direction. So generally speaking, if you're a healthy person, you're not going to have an issue. But if you're an older person and you perhaps have valves that are not working as well, then if you're not moving your legs, then you're going to get a lot of the blood pooling in the lower extremities, and you've got a risk of clotting, so we can have deep vein thrombosis, which is what happens when you do long air travel and you stay seated and you don't move about. Or if you have compromised function of the skeletal muscle. So I often think of people that are older who might have an injury to the muscle, or they might have decreased range of motion. They can't activate this pump as well, so they don't get the blood going up to the heart. And one of the things that I wanted to just mention is that if the skeletal muscle pump doesn't work properly, it can cause something known as venous insufficiency. Okay, and venous insufficiency is basically the veins not working properly to get the blood back to the heart. And it means that when you get that blood pooling, you also get the appearance of varicose veins, you get the potential appearance of ulcers, you get edema, so you get really swollen feet as well. And you've probably seen pictures of people that have swelling in their lower extremities because of this mechanism not working properly. So that's how important the skeletal muscle pump is in getting blood back to the heart and for it to work correctly.
Yeah, so it is really complementary to the heart, as you said. If it's
Yeah,
if the muscle isn't pumping, because it literally is, right? It contracts, it relaxes. While
yeah,
it relaxes, blood gets through, and then when it contracts, blood gets ejected out and pushed back up, like you said, against gravity, up back to the heart. And you need those two out of three, because it's still another one, but those two pumps have to work together.
yeah,
And like you said, if you don't have an official skeletal muscle pump, then that's going to affect venous return, which affects preload, which affects ejection, and so on and so forth. So
yeah.
it's a loop. We always, or at least I always thought of it as starting from the heart, but it is really just a loop.
It is.
We have to see it as that. If we just think of the heart as pushing and nothing else happening, we only see a fraction of the picture.
Exactly. Yeah. Hit the nail on the head. And you mentioned about the other pump as well. So if I turn the figure around again, so the other pump is the abdominothoracic pump, or the the respiratory pump. And the simplest way for me to explain that is, imagine your lungs are obviously housed inside here, and this is your thoracic cavity, so you've got your rib cage, and every time we kind of breathe, so if I take a deep breath, you kind of see my rib cage move upwards and outwards, and you see my rib cage move away from the sternum, move away from the spine. So I'm kind of like, becoming thicker, and what that does is it increases the space inside the thoracic cavity where the heart is and where the veins are, the inferior and superior vena cava. So once the skeletal pump gets the blood to the heart, it actually goes into a main vein called the inferior vena cava. So it comes from the bottom and it drains into the right atrium. So if we imagine that the heart is inside the rib cage here. Now, when I breathe in, then my rib cage is going to expand, and it's going to allow greater space for my heart to expand as well. So the right atrium, which is receiving blood from the vena cava, will expand as well. And the vena cava, which is obviously also housed within the thoracic cavity, will also expand. And essentially what you're doing is creating space for blood to kind of gush into that space. So all of that blood that's been pumped by the skeletal muscle pump back towards the heart now has the space to really kind of move into the heart. That's how the abdominothoracic or respiratory pump really works, is creating a change in pressure or space, which allows these structures to expand. The other thing as well, underneath here, and I'm always reluctant to move this when we're doing it, because things are just going to fall off. I can just see this guy collapsing, but we've actually got the diaphragm muscle as well just here. Now when we take a deep breath in, you can kind of see the diaphragm flattening, and as it flattens, what it does is it compresses all of the blood vessels of all of the abdominal organs, and that squeezes them and forces even more blood back to the heart. So that's another way the respiratory pump works. Every time we take a deep breath, we're squeezing those abdominal blood vessels, or the blood vessels around those organs, and getting more blood to the heart. And when we think about what happens during exercise, we're breathing faster and more deeply. So what I've talked about is more exaggerated when we exercise, and that further enhances the venous return and the blood that's coming back to the heart. And obviously, as we mentioned earlier, the more blood coming back to the heart, the more blood that can be pumped out back to the working muscles again.
Yeah, and so I mean, it brings up another point, which is the importance of just breathing mechanics in exercise, because if you're hyperventilating and you're not allowing that seesaw, I guess, action between the intrathoracic and intra-abdominal cavities to happen with that change in pressure with the diaphragm in the middle, then you're going to be limiting that potential of or limiting even more that potential of venous return to the heart, and so you also have to think about how you breathe, and that's going to affect how your heart pumps and then everything down the line, right?
And I suppose I'll ask you a question, because when you're working with your clients, and that's a really interesting and very logical point, when you're working with your clients, how often do you tell them to concentrate on the breathing?
It's something that I'm interested more in more and more. I have means to quantify it now with some metabolic analysis tools. So essentially, just measuring not only the oxygen in and out, but the how somebody breathes during exercise. And what I've seen, I don't have 100 tests under my belt yet, but what I've seen already quite a bit is that people tend to breathe a little bit faster than they probably should, given the intensities that they're at, and then not use volume enough, right? You have that interaction between respiratory frequency and tidal volume, so how much air you move in each breath. And essentially, if you're at very low intensities, for example, if we talk in endurance parlance, zone 1, zone 2, you should be staying between 18, maybe 20 breaths per minute, and I'll regularly test people and see them up in the 25, 30 range already, even though they should be actually just moving more air. So like you said, just making better use of that seesaw with the diaphragm, taking more time for each breath. For example, you could tie it together with a cycling cadence. So if you're a very practical example, if you're at 80 RPMs and you breathe in on 4 pedal strokes and breathe out on 4 pedal strokes, you're going to be at 20 breaths per minute. So if you're at low intensity, you can kind of zero in on that without counting your breaths. You could do the same with walking. You could do the same with jogging, with running as well. And for me, it's becoming a more important part of what I look at when I test people, what I talk about when I coach people as well, because it has, I mean, breathing has so many other ramifications. We're getting a little bit off topic of the circulation here, but it is really a system that affects all other systems. We could talk about the nervous system. The autonomic nervous system is going to be affected by how you breathe. We talked about a few other ones that here could be affected directly. So I think I do think it's an underappreciated part of exercise. And to be brief, I guess it demands more inquiry, and people would do well to spend a bit more time thinking about how they breathe in what context, I think.
I agree. I think that term, I think I've read the term entrainment, matching your breathing to the cadence or rhythm of the movement. And I agree. It's it just seems logical when you think about it physiologically. And certainly I think coaches could do, if they don't already use that kind of approach, they should definitely consider it, because it makes sense from a physiological perspective, and probably one of the most effective ways to improve training and performance as well.
Yeah, I would agree with that.
Yeah, perfect. Okay, so I think that's everything about those 2 pumps, unless you've got some other questions.
No, I think you covered everything that we were set out to cover, and that gives a good overview. And I got some answers as to how those things work, and then in what context they work, and then like you said, what you explained about the 2 other pumps, I guess, because we do have 3 of them. It helps, I think, integrate helps us picture the integrative nature of the systems that work in the body. It's not just the heart and then just the lungs and then just the muscles. They're all intertwined and they work together. And so it's a good reminder to maybe zoom out a little bit on our perspective, look at things a bit more broadly. And obviously it makes things a little bit more complex, but we're studying the human body, so we're going to have to deal with that.
Oh, definitely. Well, it's been an absolute pleasure, Sean. The questions were really, for me it's like you said, to think about those questions again, and to try and think about the different perspectives and how much we know and how much we don't know yet. That's really, even for me, it's fascinating, because quite often you do get lost in detail about things, and this helps to kind of take you out of the detail and relook at it in a kind of fresh perspective. So I'm looking forward to what we're going to do for the viewers. We're going to carry on this session again and produce another video in a couple of weeks' time, and that one is going to be looking at the effects of nitric oxide on exercise performance and kind of energetics and blood flow and how it can improve performance. And certainly that's a very big area, isn't it? Nitric oxide supplementation, especially amongst athletes, has kind of is quite a big area, and there's some world leading experts in that area that have published quite a lot of stuff. So certainly I'll be looking. It'll be interesting for me to kind of look in to the research about that, and then kind of hopefully answer some more of your questions as well about that.
Yeah, that would be great. Thanks so much for taking the time for that call today. It was a lot of fun, and learned quite a few things. So looking forward to the next one.
Brilliant. Thank you very much, Sean, and hopefully I'll see you soon.
See you soon.
Perfect. Take care.